Hello and welcome to the CastlePo EForum on the revised Code of Ethics. The Code of Ethics is required reading for the 2022 self-assessment tool, and we thought this would be a great opportunity to discuss it. Before we start, just a reminder that for best viewing of the EForum, you can close other programs that are open on your computer. If you have any problems with the webinar, best would be to close down GoToWebinar and then return into the session. Also, the recordings and slides will be posted on the website under events and eForums. You can find on your screen a little red arrow. By clicking on the arrow, a menu will appear. And in there, you can see the handouts. We have the Code of Ethics available in English and French. It's really important to have these, or your preferred language one, open either electronically or printed out, because we will be using them with the scenarios later on in the presentation. And there's also a menu that you can type in questions to us. We will have time for questions in the middle of the presentation and then again at the end. And if we don't get to all the questions, we'll respond to them later on. My name is Dana Prucci. I'm a speech pathologist and the Director of Professional Practice and Quality Assurance.
Good afternoon, everybody. I'm Sunita Joglekar, and I'm the Audiology Advisor and Manager of Mentorship, and I'm also an audiologist.
And hello, everybody. I'm Sarah Chapman-Jay, and I'm a speech language pathologist and advisor for speech pathology, professional practice, and quality assurance. So welcome to all.
Here is our agenda for today. We will start off talking about why the Code of Ethics was revised. We'll look at the process for revision. Then we'll look at some specific parts of the Code of Ethics. We'll have some scenarios where, again, you'll need your Code of Ethics, and then hopefully we'll have time for some more questions at the end. So let's begin with why was the Code of Ethics revised? CastlePo's Code of Ethics defines the broad and overarching principles that registrants are expected to observe in any professional situation. CastlePo protects the public by regulating the practice of audiologists and speech-language pathologists in Ontario. This protection includes the creation and revision of bylaws. The Code of Ethics is a code of conduct for our professions, and it was prioritized because it's relevant in all sectors with all patient populations. Registrants are always encouraged to use ethically based thinking and reasoning in their patient and professional interactions and behaviors. The Code of Ethics is different from practice standards, which are more specific to practice areas, like consent, supervision of support personnel, and conducting assessments. The Code of Ethics is a companion document and is to be used with legislation, regulations, practice standards, and guidelines. For example, reports to Children's Aid Society are not specifically mentioned in the revised Code of Ethics, as they're outlined in the Regulated Health Professions Act, Schedule 2, Sections 85.1 to 85.6, and in the Child, Youth, and Family Services Act 2017. The Code of Ethics is often referred to by various departments of CastlePo. We changed to high-level, high-principled expectations for registrants. The Code of Ethics is meant to represent the ethical code of behavior for the professions. In some instances, the original Code of Ethics stated the rules rather than the ethics behind it. For example, in the original Code of Ethics, we had 4.3.6, which stated that registrants shall cooperate with appropriate public officials to the extent required by law. In the revised Code of Ethics, we changed it to Principle 3, accountability, where registrants are required to act with integrity and be responsible. As the Code of Ethics is well used in conduct and practice advice, it's important to show if someone is or is not following expectations. We needed to ensure that it's still relevant. The original Code of Ethics could be difficult at times to enforce, as articles were too narrow to apply to all situations. It had also been 11 years since the original Code of Ethics creation. In the original Code of Ethics, we had 4.2.5, which talked about having intervention occurring primarily through face-to-face interactions. And now with technology, that's changed a bit. So we have Principle 2, patient benefit, which talks about protecting and acting in the best interests of patients, and specifically 2D, using all reasonable resources. The original Code of Ethics did not identify or address risk of harm in practice. And we also felt that the Code of Ethics should reflect CastlePo's core value and strategic plan of diversity, equity, and inclusion. 4.1.7 talked about not discriminating in relationships with either patients or colleagues. And we decided to change to have an addition in Principle 2, Patient Benefits. There's more language to include not just the patient and colleagues, but the individual patient, family members, substitute decision makers, colleague or person supervised. And in 2B, the idea of patient-centered. That was new vocabulary that was added. Finally, there was a lot of information that was duplicated in other documents. For instance, the original Code of Ethics talked about supervision of support personnel and ensuring all equipment used is calibrated and in proper working order. These are not ethical issues and they're written elsewhere. We have the example of 4.2.8 in the original Code of Ethics, which talked about maintaining adequate records of service. Now in Preamble 1.2, it says the Code of Ethics is a companion document and should be applied with relevant legislation, regulations, standards, and guides. And now I'm going to pass it over to Samita to talk about the revision process.
Thank you so much, Dana. So let's talk about the revision process, and I'm going to spend a bit of time taking you through the process that we undertook to revise the Code of Ethics, starting with the Practice Matters Committee. And this is a committee that directs the revision of documents such as practice standards, considering the current practice environment. With the case of the Code of Ethics, this was a recommendation that also came from our registrar to the committee. And this was because of CastlePo's commitment to diversity, equity, and inclusion. It was important to ensure that the language and the principles in the Code of Ethics for our professions are reflecting the principles of diversity and equity and inclusion accurately. So then we moved into our environmental scan, consultation and research, which we do with all documents. We looked at many other regulatory colleges, their Code of Ethics, the principles that they are using, and specifically looking at ethical decision-making and the philosophies and principles that are most important to healthcare. We then moved into drafting the document, and we took this draft to an advisory working group. And this is a very important step in the process because this is where we had practicing SLPs and audiologists who met with us and provided us with very useful feedback on the Code of Ethics, the revised document, and the principles. And we really try to include professionals in the group who are coming from different environments, working with different patient populations, with different levels of experience, and who can reflect on the principles and tell us whether they are applicable to their work and in their work setting. So then the document went back to the committee and was approved by council for a stakeholder review. And this is where you may have participated in giving your feedback on the document. And that is very useful as well because we take those comments and suggestions into account. And then the document was finally approved for publication in October of 2021. So looking at the results of the stakeholder review, we had 345 respondents. That included 107 audiologists and 224 SLPs. We also had members of the public and other professionals. And as you can see, there was a very high level of agreement with the new Code of Ethics in terms of the clarity of the document, being able to implement the principles in work settings and in practice, that the principles and paragraphs encourage ethical decision-making, and that the principles and paragraphs are in the public interest and will protect the patient. And just to clarify what we mean by paragraphs, if you look at your Code of Ethics, under each of the 4 healthcare principles, ethical principles, you'll see a series of statements lettered A, B, C, D, and we refer to those as paragraphs. In the stakeholder review, there was also a very high level of agreement with being able to understand how the Code of Ethics works, and also that the Code of Ethics accurately reflects registrants' ethical judgment, decision-making, and behavior when providing services. Looking at the comments that we received from the stakeholder review, we received significant positive feedback. Lots of comments to say that the Code of Ethics was comprehensive, that it was concise, that it was easy to follow, and that it was improved from the previous version. We also had some comments asking for some clarification around accurate, fair, and reasonable when it comes to fees for service. And we're going to look at a scenario later that will help to clarify some of this terminology. And then we had other suggestions that were grammatical or content related. For example, there was the suggestion to move privacy and confidentiality to accountability rather than have it under patient benefit. So that's an example of a suggestion we got from the stakeholder review that we applied in the document. So we'd like to thank those of you who are watching today who took the time to respond in the stakeholder review, because we really took your feedback into account and applied many of your suggestions. So I will pass it over to Sarah now for the next section.
Thanks so much, Samita. So yes, so let's now take a close look at this new Code of Ethics. And again, as they both mentioned, Dana and Samita, hopefully you have your own copy to look at, because it's going to become very useful in the scenarios. So let's just take a look. What does it involve? We have the preamble, and we have 4 key ethical principles: patient autonomy, patient benefit, accountability, and do no harm. So we are going to delve in here and see what they say. So looking at the preamble, what does this do? So the Code of Ethics defines the principles that you, audiologists and speech pathologists, are expected to observe in choosing the fair, equitable, and just action. So it's expected, of course, that you maintain high standards of conduct in your practices and all relationships with patients, with the public, other professionals, I mean, in truth, anybody. And then 1.2 is to note that the Code of Ethics is a companion document. And what do we mean by that? So it is a companion to all of the CASPO documents, such as legislation, regulation, standards, and guides. Sorry, legislation is law, it's beyond CASPO, but the regulations, standards, and guides. And it's applicable in all practice, education, and research environments. So moving on from there, we're going to talk about the principles. Principle number 1 is patient autonomy. And I think sometimes the word itself tells you patient autonomy. But what does that mean? It means that you acknowledge and that you respect patients' rights to make their own informed decisions and choices in their healthcare. Now, of course, you're helping them with those informed decisions. Now, the principle number 1 is split into 5 paragraphs, as we mentioned earlier what these are. So it's where patients and substitute decision makers collaborate in any clinical decisions, and that they are clearly informed of what the services will involve. They can decline any part of the service plan. If they choose, they can discontinue services, and they can explore alternative service options. And throughout this, they do have a right to confidentiality, that you respect their right to keep all the personal health information confidential. So now let's take a look at principle 2. This one is about patient benefit. So what happens with patient benefit? In this case, of course, you're going to respect the patient's rights to make informed choices and decisions about healthcare. And you're not discriminating against anyone. You're using patient care-centered care, advocating where it's applicable and where appropriate. You're providing quality evidence-based service, and you're recommending referrals when when either, it's outside of your scope of practice, it may be beyond your competence, or there is relevant referrals to other specialists, professionals, even programs, resources that are out there. Educating patients and substitute decision makers, and collaborating and communicating. So you're always treating all patients justly and fairly. So now let's take a look at principle 3, accountability. And again, I think this word, it's very clear what we mean. Being accountable. You take that personal responsibility for your own behavior, actions, and decisions. And that does include during supervision. So you want to act with integrity. Now, again, this is going to come up in scenarios, so listen well to each of these principles. There are 12 paragraphs in this one. We're focusing on a few of them, and these do include acting in a professional and respectful manner. I think that goes without saying. That applies throughout any plan of care that we're providing to patients. Being honorable and truthful, exercising professional judgment, maintaining standards and dignity, and working within your scope of practice. So being very sure of where the professional boundaries are, as well as what your scope is, and developing and maintaining those professional relationships. And then our final principle is to do no harm. Again, kind of self-explanatory, but I think the important thing here is that you, as the audiologist and speech language pathologist, are going to assess the risk of harm and prevent any harm from occurring. Now, up until now, the first 3 principles we're talking about audiologists and speech pathologists shall do the following. In this case, we're talking about what you shall not be doing. You shall not disregard professional boundaries. You shall not engage in unethical business practices. You shall not practice in a conflict of interest. And you shall not harass a patient in any shape or form, so verbally, physically, emotionally, or sexually. That's a few of the 8 paragraphs in Principle 4. So we thought it's sometimes useful just to let you know where you can find these standards on our website. So we have an image of our homepage, and you will go to resources. And then when you've clicked on resources, it will take you to standards and resources. And then once you've entered that page, you've got choices. And in fact, Code of Ethics in English and French has its own section. So you can go directly to Code of Ethics at any time. Now, it's also important to note that because of the importance of Code of Ethics, we actually have it available in many places on the website. If you're in audiology practice, you can find it there. If you go to speech language pathology practice, you can find it there. It's also under legislation, regulations, and bylaws, and it's also in public protection. So there are many ways of finding the Code of Ethics. So I think this is a good time maybe to take a pause and see if we have any questions from our attendees. And we'll see if there are or not.
We have one question that's come through that's asking, can you talk a little bit more about how you determined the 4 principles that have been included in the Code of Ethics?
Mm-hmm. Great question. Yes, because actually when we were doing the environmental scan across different regulatory healthcare colleges, also across the country with some other regulatory bodies, absolutely everyone has Code of Ethics. And so we did that scan with the other colleges, other associations as well, and determined which were the most applicable for us as speech pathologists and audiologists. And again, because you talked about the process, I think that, that there was kind of the fine tuning during the process, with the Practice Matters Committee, the Advisory Working Group, new versions, new drafts, and hopefully people are satisfied with this final version. Anything to add, either of you?
Yeah, no, I agree with all of that. And it was really that process that helped us really hone in on the 4 principles, looking at especially the other rehab colleges. And we collaborate a lot with the other regulatory colleges. And so consulting with them was extremely helpful to know that this terminology was going to speak to audiologists and speech language pathologists.
Yeah, excellent.
There's one question that's come through that says, can you restate what the 3rd item was under do no harm?
The 3rd item under do no harm. Absolutely. I'm going
so if
to
you look,
ethics.
me too. So if you look at your paper version,
Yes.
it's C, which is that we shall not, audiologists and speech language pathologists shall not verbally, physically, emotionally, or sexually harass a patient. So that's the 3rd item.
On the slides, we only had a few of the paragraphs listed because some of these principles have many paragraphs. So the one that you're referring to might not be what was actually 4C, but if you look at the actual code of ethics, you'll see all 8 of them listed.
And we will be exploring these obviously when we get into the scenarios. It's hopefully very interactive, so it'll be an opportunity for each of you to check out your copy of Code of Ethics and all the paragraphs that come under the principles. That'd be great.
We don't have any other questions that have come through at this time.
Okay.
Okay, so let's carry on. All right, now it's time for the scenarios. So if you could please have your code of ethics in front of you, again, electronically or on paper, we'll be asking you to participate and refer to the code of ethics as we go through the scenarios. We'll be putting up some polls so that you can say which code of ethics principle you think applies to the situation. And just to mention that these scenarios are based on real calls and situations that conduct and practice advice receive. So here is scenario 1. After discussing information about possible treatment options, a patient chooses to go elsewhere and move forward with hypnosis. In your opinion, this is not an evidence-based treatment. So which code of ethics principles apply? So to remind you of what we're looking about, we want to think about this, and we'll ask you to look at the principles and decide which one applies to each situation. Let's do this first one together. So this is a situation where the patient or the substitute decision maker says that they don't want to go with the services you're recommending. Instead, they want to go with hypnosis. So do you think this is a question of patient autonomy? Is this a question of patient benefit? Is this accountability? Or do you think it's a do no harm? So we'll give you a few seconds to think about it, but this one we can do all together. And we think this really is a great example of principle 1, patient autonomy. You'll still be discussing the pros and cons and the details of your treatment plan and the rationale for it. However, the patient's choice must be respected if they decide to make a different decision. Specifically, this calls into question paragraph 1A, collaborate, 1B, a patient can decline all or part of the services, 1C, discontinue, and 1D, explore alternative service options. And now I will pass this on to Samita for scenario 2.
Thanks, Dana. So let's have a look at this scenario. This is a billing scenario for audiologists. So you have been offering free hearing assessments to your patients. In order to recoup your costs and loss for the assessment, you have increased the fees for hearing aid prescription and specialized tests. So we have a couple of, we're asking the question, is this acceptable? And then we have a couple of possible answers. The first being, yes, there's no problem with recouping your costs. Or no, it isn't ethical to inflate costs to compensate for services that are advertised as free to the public. So this is not a polling question, but we'll just take a moment to let you think about what your answer would be. And then we can have a look at the answer. So the answer is that no, it would not be ethical to inflate costs to compensate for services that are advertised as free to the public. And this is really getting to the idea in the Code of Ethics, the principle under accountability, that fees must be clear and accurate and discussed prior to the initiation of the services. So if a service is advertised to be free, it should truly be free. And if the public thinks it's free, but it's actually not, that can be misleading. An example of how the Code of Ethics is a companion document is that if we look to the professional misconduct regulation, that regulation says that patients may request an itemized invoice, and we are required as professionals to provide the itemized invoice so that patients understand what they're paying for and how much. So now we are actually going to launch this as a poll, and we'd like you to think about this scenario and choose the principle that you think applies most, or you can select all that you think apply. So we'll give you a moment to participate in the poll. And this is your offering free hearing assessments and recouping costs in other areas. And thank you to those who participated. We'll have a look at the results. And we can see that the majority have selected accountability. And others have selected some of the other principles as well. Do no harm. That's very good. Thank you for your participation. And let's talk a little bit about the not the answer, but what we thought was the principle that applied to this scenario. And I can definitely see how do no harm and the other principles apply as well. The principle that we wanted to focus on was accountability. So looking at the specific statements or paragraphs under accountability, that we must be honorable and truthful in all of our practices and professional relationships. So advertising fees for service, we must be honorable and truthful in that. Setting reasonable fee structures based on fair values. And this idea of reasonable is where professional consensus comes into play, as well as the public's expectations. What does the public expect to pay for our services as audiologists? What are our colleagues finding consensus on in terms of the fees that should be charged? We want to ensure that patients can access our services. So that's where reasonable comes in. Ensuring that services, limitations of services and the fees are clear, accurate, and discussed prior. We talked about that. And ensuring that we provide service in a manner that neither discredits nor diminishes the public trust. So problems can happen when a patient doesn't understand what they're supposed to pay or how much they will pay. If it's not clear to them, this can diminish the public's trust then in our profession. So we'll move to the next scenario and I'll pass it over to Sarah.
Thank you. So this one actually is related to billing as well, more for speech language pathologists. So in this scenario, you've been providing ongoing treatment to a child for many sessions, and the insurance benefits have been maxed out for the year. The parent wants you to alter the billing details so they can submit the claim under their own insurance, as you've been providing some occasional parent training during the sessions. So how would you respond to this? Would you say, yes, I'll alter the billing? Or would you say, no, the child is still a patient benefiting from your services, while of course still recognizing that parent training can be part of those that intervention? Or yes, you agree with the parent. So in this case, the answer is no. The child is still the patient benefiting from your services. But what we want to do again is check in with you all about which code of ethics principles apply. So the child's insurance policy is maxed out. Parents want the bill under their own name. So again, we'd like you to make a selection which of these principles apply? Autonomy, patient benefit, accountability, and do no harm. Okay, so we'll give you a moment to vote, make some choices. And we are now going to take a look at how people feel about this. All right, so we have some different options. It looks like the highest percentage again is Principle 3, accountability, and followed up slightly by patient benefit, do no harm, and maybe patient autonomy. So great, thank you for your responses. So let's actually take a closer look about which ones we felt did apply mainly. So Principle 3, accountability, taking that personal responsibility, acting with integrity, and Principle 4, do no harm, being diligent about preventing any harm. So let's look exactly what we thought for accountability. So we were talking about 3B, that you do maintain being honorable and truthful in all your practices, and that would include your billing practices. And 3L is that you provide services in a manner that neither discredits the professions of audiology or speech language pathology, nor diminishes the public's trust. So each of us are accountable for ourselves, but also, you know, it's the reputation of all of us in our own professions that counts as well. And then Principle 4, do no harm. And really this one is about you shall not engage in unethical business or management practices. Now, what we want to add here is, I think at the beginning we talked about the Code of Ethics is a companion document. And in this case, absolutely, we want to also check in with the professional misconduct regulation. Because this does not allow any falsifying of records, which would include billing. We don't want anything that would be false or misleading, or that would lead to submitting an account or a charge for services that are false or misleading. And ultimately, we do not want anyone to be engaging in conduct that would be perceived or regarded by anyone as disgraceful, dishonorable, or unprofessional.
Great, thank you, Sarah. And now we can move on to scenario 4. You're supervising a new support personnel and you have a 3-week vacation that has been booked at the beginning of the supervisory relationship. You're impressed by your CDA and their ability to carry out the assigned clinical activities and their professional rapport with patients and families. You feel confident they will manage without you over the 3 weeks. Which would you choose? 1, no need to arrange alternative options for support, or for supervision, pardon me. 2, provide an alternative contact for supervision while you're away, or 3, provide a way to contact you while you're away. So again, this is a quick one that you can think about. And the answers that we have chosen would be provide an alternative contact for supervision while you're away, or provide a way to contact you if possible while you are away. So now let's look specifically at the Code of Ethics and think about which Code of Ethics principles apply to this scenario where you will be going away and your new supportive personnel will be at the office. Do you think it will be Principle 1, patient autonomy, Principle 2, patient benefit? Is it Principle 3, accountability, or Principle 4, do no harm? Or, of course, it might be a combination. You are able to vote for more than one principle. Wonderful. Thank you so much to everybody that answered the poll, and I will share the results now. So again, it's great to see we have lots and lots of people responding. And so principle 3, accountability, is coming out on top, closely followed by patient benefit and to do no harm. And again, it's interesting that we might have selected a principle that isn't necessarily the same one that you selected, but there's so much interplay, and we can see the reasoning behind all of them, behind anything you might come up with. So the principles that we selected were principle 3, accountability. Sorry, was principle 3, accountability, as the most important one, which is something that also is reflected in the poll, because accountability requires that you take personal responsibility and you're accountable to those that you supervise. So 3A would be the most relevant paragraph, acting in a professional and respectful manner. You would seek alternatives while you're unavailable to supervise, such as another practitioner, or provide a way to contact you so that you can still be accountable. And now here is Sumita with scenario 5.
Thank you. So let's have a look at scenario 5. This is a private practice scenario. So you have been contracted by an SLP to provide private speech therapy to clients. And you have been told by the SLP, who is also the owner and your employer, to provide 15 sessions to every child and bill accordingly. Your own professional judgment is not consulted on what degree and intensity of therapy is needed. So what are your ethical and professional responsibilities to your patients and families? So we're going to go straight to the polling question. Thinking about this scenario where you are told as an SLP to provide 15 sessions for every patient, which code of ethics principles do you think apply? And you can select all of them or one if you think one applies more. I saw one comment in the questions that you're not able to access the poll. We apologize, I don't know why that's happening, but if you'd like, you can put your answer in the questions area. So hopefully you're able to participate, most of you, and some votes are coming in. Let's have a look. Okay, wow. So we've got a spread here of answers, mostly patient benefit. Accountability are the two top principles that people have selected, participants have selected. So thank you for your participation. Let's have a look at the answer. So in thinking about this scenario, we were honing in on the principles of accountability and do no harm. Now, again, not to say that the other principles don't apply. We can definitely see how all four may apply to the scenarios that we're presenting today. Let's talk a little further about accountability related to this scenario. So under the principle of accountability, you'll see some statements, 3D, paragraph 3D, about exercising independent professional judgment throughout the provision of any professional service. So if you are being asked to always provide 15 sessions to every child, it's really not allowing you to exercise your judgment. And that can be a bit of an ethical dilemma because it may not be appropriate for every child to receive 15 sessions. Maybe that's too many sessions for a particular child. It's not needed, or maybe that won't be enough for a particular child. Looking at 3L, to provide services in a manner that does not diminish the public's trust. So our code of ethics, as well as our practice standards, are requiring us to provide patient-centered care and to place our patients' needs first, which means we have to take their needs and their circumstances into account and tailor our services to the needs of a particular patient and family. And if we are not doing that, it can diminish the public's trust in our professions. So let's have a look at the principle of do no harm. These are the things we shall not do, and that includes engage in unethical business or management practices. So this practice of providing 15 sessions to every child, it could be an unethical business or management practice for the reason that I mentioned, which is that it may not be required or it may not be enough. So it's not patient-centered, and there could be other factors that are at play. Again, looking at how the Code of Ethics is a companion document. If we look at the conflict of interest standards, there is a standard there that says that we must not enter into an agreement with any person or agency that limits our ability to exercise our professional judgment to provide appropriate recommendations. So when this happens, it's important to go to our managers, to our employers, to bring the Code of Ethics with you, to bring the practice standard with you, and to explain that this may not be a good way of structuring services for your clients. All right, moving to the next scenario, over to you, Sarah.
Thank you, Smita. And we are keeping an eye on the questions, and we are aware we are covering a lot of material in this session. And you know, maybe it's the first time you're taking a close look at this new Code of Ethics. It's okay. I mean, we've lived and breathed this for over a year, maybe two. It will take time. This is what we want you to do, though, is take a close look. And hopefully this is like an intro if you haven't looked already. So let's look at this next scenario. You work closely with a colleague and inadvertently see that they have been sexting their current patient. So which of the Code of Ethics principles will apply to this scenario? So again, we're going to have you poll, take a look at your Code of Ethics, take a look at the different principles, and decide which of these may apply to this situation. So the colleague is sending inappropriate text to a patient. And we like to just give you a moment to vote. And it looks like we have the answers. And actually, yes, I'd say fairly unanimously, 96% are certainly looking at principle 4, do no harm. And again, accountability, you know, and you will see that there's sort of an overlap at times with principles, but absolutely principle 4, do no harm, relates very well to this scenario. So let's have a closer look at what we are thinking. We also felt strongly that principle 3 and principle 4 do relate to this scenario. So in principle 3, of course, we are always talking about acting in a professional and respectful manner in all your practices. That you want to maintain professional relationships with the patient, have very clear boundary, clear boundaries, professional boundaries, basically, and maintain the standards and dignity of the profession in all communications. And then principle 4, which was unanimous, really, do no harm. You shall not engage in sexual relationships with any patients, and you shall not disregard professional boundaries in the healthcare relationship. So I think it's also important to notice at this, to mention at this point, that a sexual romantic relationship is always an inappropriate boundary violation. And again, a companion document, in this case, it is the Regulated Health Professions Act that is for all regulated health professions. It identifies that sexual abuse of a patient by a registrant to be any of the following. So sexual intercourse, other forms of physical sexual relations between the registrant and the patient, touching of a sexual nature of the patient by the registrant, and this, in this scenario, behavior or remarks of a sexual nature by the registrant towards the patient. So the other thing is the Regulated Health Professions Act defines a patient as an individual who is receiving audiology or speech pathology services currently, right now, they're actively a patient, or within a year of the treatment relationship ending. So if you at any time have some reasonable grounds to believe that another registrant, either of our Casapo's college or a different college has sexually abused a patient, then a mandatory report would be required to be filed with the relevant regulatory college. And in fact, a penalty would be that the registration would be revoked for that registrant, and they would not be able to reapply for at least 5 years. And back to you, Dana.
Thank you, Sarah. And our last scenario, scenario 7, is your colleague makes a derogatory comment about your patient within earshot of the patient. Which code of ethics principles apply? I'll open up the poll. So I think we're getting the hang of this, that we have patient autonomy, patient benefit, accountability, and or do no harm. You can mark off any that you think are relevant. All right, now we'll close this in a few seconds. It's amazing to see all these responses flying in. So here are the results. There were lots of votes for Principle 4, Principle 3, and Principle 2, and a little bit for Principle 1 as well. And so now I can share what we were thinking. So we thought that the 3 most relevant principles in this case are Principle 2, patient benefit, Principle 3, accountability, and Principle 4, do no harm. First, it should be said that no one should be subjected to racist or discriminatory remarks. Principle 2, patient benefit, was relevant for paragraph 2A. Registrants shall not discriminate against anyone. 2B, provide patient-centered care. And finally, 2C, registrants shall advocate for patients and families when appropriate. And Principle 2, patient benefit, talks about protecting and acting in the best interests of patients and treating all patients justly and fairly. Principle 3, we talk about taking accountability, being accountable, taking responsibility for behaviors, actions, and decisions. 3A, acting in a professional and respectful manner, being honorable and truthful in 3B, and paragraph 3C, initiating steps to mitigate any harm. And finally, there were lots of votes, and we agreed for Principle 4, do no harm, specifically 4C, verbally harassing a patient. A patient should never be harassed in any way, and registrants are to be diligent in efforts to prevent harm from occurring. So this brings us to the end of our scenarios. Hopefully this was an activity that was really helpful to understand how you can have the code of ethics apply to real life situations, again, situations that we have heard about through practice advice and in conduct. And so we can open the floor to questions.
Excellent. All right, so yes, there are questions coming in now, and we're going to say ahead of time, any that we do not manage to address, we will be addressing individually to you after the EForum. If there are some that fit for frequently asked questions, we'll also be able to communicate those to all of you as well. So can I start with one of the questions? Would that be okay, Dana, Samita?
Of course.
Of course.
Yeah. All right, so one of the questions is, a hearing test and a prescription are 2 different things. So couldn't you advertise free hearing tests and then still charge a prescription fee with the hearing aids?
Right. So I think you're definitely going to be able to charge the prescription fee. I think what's happening in the scenario we talked about today is that if you're offering a free hearing test, then it should truly be free, right? So if the patient is perceiving that this service is free, it means that it really is free and you're not making up for that cost in your dispensing fee or in the other fees that you're charging for a prescription. So you're not recouping the cost. So of course you can charge a dispensing fee, you can charge a prescription fee, but the fee should reflect the service that's being provided, and it shouldn't be recouping for some hidden costs that the patient is unaware of.
Thank you. Okay, I'm going to ask another question here, which any of us can approach. If we are out of the province, so I think this is relating to that support personnel scenario that we had, you know, that the person, the SLP was going on vacation. So what they're saying is, if the SLP is out of the province, doesn't that count as practicing in another province, country, or state? So I can start off with an answer related to this. So the virtual care standards talks about the patient must be residing in Ontario, and that you do need to check any jurisdictional licensing requirements of any other province or country that the patient may be in before you initiate or continue services with them. You may also need to check as a speech pathologist or an audiologist, if you're in another province or country, that you are not contravening their requirements, any of their jurisdictional requirements. Would either of you add something to that?
I would just add that it's where the patient is located. So it's not just where they're residing. So if they're from Ontario, but the patient goes on vacation to Florida, then you can't provide services because their jurisdiction is Florida. On the other hand, if you leave the province, then it could be okay. Again, it depends on where you're going, and you can check with where they are. But assuming that in this question, the supervision of the support personnel is the same as the ruling for virtual care, then it would be okay to be supervising from abroad.
Nice. Okay. Just checking some other questions. Samita, do you have one there at all?
Yeah, there's one question I can see here. And again, there are many that we may not be able to get to. But one is, can you discuss how the code applies to non-clinical roles such as leadership? And I can start a bit with that. So I think that the principles are really important to be aware of if you're in a leadership role, if you are managing a team of health professionals that include SLPs and audiologists. And also now you are aware that other health professionals that are regulated have their code of ethics. And I think it's important to be aware of those principles, because when you're designing policies and procedures for the clinical space that you're working in, you can take these principles into account. Again, I think even if you're in a non-clinical role, because this is a code of conduct and these are overarching principles, they would definitely apply to your role, even if you're not providing direct patient care. Things like advocating for patients and families, collaborating and communicating effectively with all appropriate. You can see how these are overarching principles that can be applied in many different situations. So anything to add, Sarah or Dana?
Yeah, I would agree. I mean, I see you would be a role model, you know, taking responsibility, you know, acknowledging if there's a mistake that happens. I mean, no one is perfect. Things happen. So, you know, it's helping people be accountable, if that's part of your role, and reflecting on how you can contribute to a respectful environment. So I think many of the code of ethics principles here apply to us all, you know, and we say we as well, because even in our roles, of course, it's important for any of us. Yeah. Anything else to add there?
No. I see that there were a number of questions that came in after the private practice scenario with the SLP, where it was a block of 15 sessions that were going to be provided. And there are some questions. There's one that says, how does the 15 sessions imposed by a private practice contract differ from a therapy block outlined by a hospital or community care agency? So juxtaposed with the scenario that we presented, I think I can comment a bit on that. So the scenario that we presented is, I think what's important to consider is what's the rationale behind the block? And, you know, is there a clinical rationale? Or is there some type of restriction to the service? If we look under, we've talked about the principle under accountability, that it's important to discuss the service delivery options, any limitations to the service. So there may be a rationale within some settings where SLPs are working for why there's a limit to the number of sessions that you're providing. It's important then that that be discussed with the family or with the patient so that they understand what to expect. Can they stop early if they wish to? What would happen if they needed to stop early? What would happen if the block wasn't enough and they needed more service? Then how would you be able to assist them to find that additional service that they need? So it's not always unethical that this is happening. I think we have to think about, is there a conflict of interest? In the scenario we had, it was more that there was a conflict of interest and maybe not a clear clinical rationale for why it's that particular block of therapy that's being proposed. Sarah, would you add anything, or Dana?
So I think that's a very good answer. And I would say also that in this scenario, when it has come up, the employer is the one that's saying, you have to see this client for 15 visits. Even if they don't need it, we have to be billing them for 15 visits. And that's different from the public system where there's a limit because there are a certain number of patients that need to be seen. And so by the employer saying you have to see them for 15 minutes, they're taking away the clinician's accountability and their ability to decide on what it is that the patient needs, and they have to defer to someone else.
And that comes to that exercising independent professional judgment throughout provision of professional service. Yeah. Good questions. And there are a lot. So already we're going to apologize. We're not going to get to them all.
I think we have time for one more.
I know that there was one saying it was somebody who wasn't able to participate in the polls, and they're concerned that they are not going to be able to count it as continuing learning activity credits. Absolutely not. If you're listening for this hour, you count them. Don't worry about the technical problems that were happening. It would be included and suitable considering it's SAT time this January as well. So yes.
I see there's one question that's saying, what's the difference between a code of ethics and a code of conduct? And I think we've been sort of using the terms interchangeably, because really, as a regulatory body, the code of ethics is essentially a code of conduct. There's other ways that we've heard of code of conducts being applied, like different practices can have a code of conduct for their employees, or even a code of conduct for patients or clients sometimes. So I think generally the code of ethics is, as Dana explained at the beginning, these are the overarching principles that guide our decision making in every situation. And those terms can be sometimes synonymous. In this case, I think this is the code of conduct for our professions.
Yeah.
Thank you so much. So I think we have about 1 or 2 minutes to spare. So I'm going to close down the questions. But again, we really wanted to thank everybody for attending or for watching this after the fact, as it is going to be published to the website. A reminder that the Code of Ethics is required reading for the 2022 self-assessment tool. If you have any questions, you're always welcome to call or email the practice advice team if there's anything that wasn't clear. If you have a question that wasn't answered, we will try to get back to some of you if we didn't answer your questions, or potentially put out a frequently asked questions practice advice article as well. Thank you so much, and wishing you all the best.
Thank you. Have a nice afternoon.
And thanks from me as well. And of course, as Dana said, we are available if you've got any additional questions, and we hope to follow up with the questions that you've left with us that we haven't addressed today. Have a great afternoon, everybody. Thank you so much.